Time is running out here. We are down to the home stretch. Tomorrow is the last day for the open enrollment period, and we're talking about in the marketplace. We're talking about in the marketplace, and this is for anybody who needs insurance outside of employer insurance, outside of Medicare. We just in the annual AEP for Medicare. So if you need insurance and don't have it at your job, or you're not working, you make a little too much for Medicaid, but like I said, you're not old enough or meet the qualifications for Medicare, now is the time. You have until tomorrow to go into the marketplace and choose a plan. Now, I've been seeing several plans that have a $0 premium. So I wanted to pop on here today and just be here to help anybody who needs help to get enrolled. I have a link that I'm going to pop in the description area here, so you'll know exactly where you need to go to enroll. But time is running out. So tomorrow at midnight, that's it. And you want to get your plan going, and this will be effective January 1st. There are tons of plans to choose from. Typically, if you make under a certain amount, you can get $0 plans, but you have to plug in your provider's names, your doctor's names, and I can help you do that, but my system allows you to do it yourself online, but if you need my help, I'm fine with that. You plug in your doctor, you plug in your medication, then you can make a clear determination of which plans will work best for you. Typically, when we're looking at the enrollment options, you see some things called MOOP, which is maximum out-of-pocket. That term refers to the amount that you're going to pay, the cap for the year that you're going to pay. And once you reach that cap, the plan covers you at 100% for the remainder of the year. That's different from a deductible. You've heard of deductibles too. And with your deductible, that's the amount you're responsible for before you only are responsible for a co-insurance. For the company or the carrier that you choose, the insurance carrier you choose will pay a portion of your bill, and you're just paying the co-insurance. So if you have a deductible and you have something major that happens, you're going to be responsible for that amount before the plan comes in and helps. So say, for instance, you have surgery, your deductible is $1,000, and your surgery is $500. You're going to be responsible for that full $500. Then say, for instance, later on in the year you have another surgery and it's $800. You've already met $500 of that deductible, so you're responsible for another $500. And then of that remaining $300, you're responsible for whatever your co-insurance is for that procedure, and the company pays the rest. So that, it's a process, and it can be tedious with understanding exactly what's what with it. But it's important to really speak with someone who can break these things down for you. It used to be to the point where we're just looking for a plan, the cheapest insurance plan. But now we know that it's way more to it than it just being the cheapest one, because you can get the cheapest plan and then it doesn't meet your needs. Okay, so that's going to be something else to consider. What are my needs as I'm searching for a plan? And then once I have identified what my needs are, who are my providers, and what prescriptions am I taking? Once you determine all of that, you plug that information in here to the system, and then it gives you tons of different options and pricing, and you can sort it by price lowest to highest. You can sort it by the lowest deductible. You can sort it by the lowest maximum out-of-pocket. So there are several options here as you're searching, but the most important thing to do is just get your free online quote. I know the marketplace is necessary, but it's more necessary now than ever, because people are having issues with their employer benefits where it's not suitable. It's expensive, but it's not covering everything. So this is giving you the option to go out and search for yourself and find a plan that works for you, and that really fits your needs. There's no need to be paying for no insurance that you cannot use. All right, so any questions you have, just let me know. And like I said, I will be here to answer all of the questions or get you the answer if I don't know it. But it's just going to be super important to get these applications completed between today and tomorrow. All right, hold on. Let me check here to see what questions I'm getting in. I'm trying to do two things at once. Okay, I see a question here. When my wife had her baby, she gave them her, oh, when my wife had her baby, she gave them her credit card instead of her insurance card. And since we've had our baby, they've been sending us bills, $300 per month. And now we are looking for our $12,000 back. I don't know what insurance you had there, but all I can say is it's tough trying to get reimbursed from insurance companies. You just better have uh, all of your receipts and everything lined up. Now, one thing that is important is that if you're saying that you were insured when that happened, uh, you would need to reach out to the insurance carrier. That could probably get you your answer quicker. You reach out to that insurance carrier and let them know the date of the service. Um, and you're basically filing a claim and trying to get reimbursed for it. I would definitely go that route. It looks like you were trying to reach out to the hospital or the doctor's office. My understanding, I may be wrong, but whatever the case may be, you definitely need to reach out to your insurance carrier and see what their process is if you haven't already done that. I wish you the best on that. That is tough. Yeah. All right, let's see the next one here. Yeah, I can't believe open enrollment ends tomorrow. It flew by. It flew by. Just so you know, guys, I can give you a thorough health insurance review focused on your needs. Like I said, that's going to be important. Some people, it's tough to try to figure out what questions to ask or to make sure we're covering all of our bases as we're searching for plans, okay? But keep in mind that I'm here for you um, as your insurance advisor, and I can help you identify those needs. I can help you access those plans um, that you may not be able to find in the marketplace. I know certain things I need to search for to find, and if you're not finding what you're looking for when you click on my link, uh, just let me know and I can help you find that. I've been doing this for, I got another question, how long have I been doing insurance? I've been doing insurance for over 10 years. I started in 2009 in human resources, so on the employer side of it all, doing group insurance, and then navigating to the individual side, Medicare, supplemental coverages, and even life insurance. And so all of that was done on the employer side for me first. But yeah, over 10 years. Um, I'm licensed in all states, and it doesn't matter where you live. Uh, these plans offer options in the various states that you live in. Yeah, and once we get connected, I'll definitely be here throughout the process. You know, New Year starts, your plan goes into effect. If you have any questions, you don't understand a specific benefit, you can definitely reach out to me. You can also you can message me, yes, but you can also call me at 561-412-5218. Guys, if you want to jot down my license number is 202-64024. I see here that somebody needs a specific specialist that is not available in their area. How would they go about? What are their options? Typically, if you need a specialist or any doctor for that matter, and they're not available in your area, you probably want to. Do you mean they're not in network in the plans in your area, or there is no? Okay, because if there are no, if they are not in the network, you may want to consider getting a PPO where you can go in and out of network. When you get PPO plans, they're more flexible. You may pay more when you go out of network, but you have that flexibility where you don't have to have a referral to go out of network, but you do have that opportunity to do so. And then there's no issue if that doctor is not in network. But you can definitely, there's several ways to search to make sure a doctor is in network. And you want to try to check all of those out with your doctor. You can check the different doctors in the practice that you're going to. If there's another doctor in the practice outside of the one that you're specifically seeing, you can look up their name. You can look up the practice's name and see how they fall in those plans. Let's see. Prescription drugs, a lot of times with prescriptions, if you are taking a medication that is not covered by a plan, you can see if your doctor can prescribe you a generic if it's not a generic. Um, but and there's a formulary for every single plan, and it goes by the tier level of the drugs. So all of that plays a part. You need help typing in those medications and specifically seeing which plans reflect your specific medication. Just let me know. Right, so I just finished annual enrollment period, AEP, with Medicare. And with Medicare, you know, you have to be 65 or have a disability or any age if you have end-stage renal disease. So with the Medicare, they have a lot of advantage plans that allow you to get medical, dental, and then, you know, silver sneakers, a lot of added additional benefits. And a lot of those are no cost. So if someone is needing to get insurance and they come to me and they are 65 or older, I will guide them to or ask them some probing questions to see if they are able to do some type of special enrollment period for Medicare. Uh, there could be several situations where they may not be eligible yet. If they're 65, they could have opted out of Part B, you know, whether they were working and opted out, whatever the case may be, we would have to ask some questions and then refer them uh, to or schedule an appointment for next year AEP if they want to get an advantage plan or prescription drug plan, because outside of that, what are their options? They can just keep their original Medicare. That has coverage too. It doesn't have the dental. But if they wanted to pick up dental, they could in the marketplace right now. So here's a typical scenario. Say, for instance, you have a household size two people, and your income is between 19,000 and 27,000. So fairly low, but you are not at the poverty guidelines for Medicaid. You're likely to be able to get a plan in the marketplace on the silver level, like an HMO with a $0 premium. Okay, and so we're talking, like maximum out of pocket $1,700 for the two of you. And with that same plan, you could get like your primary care visit $0, to see specialists at $0, and then all of your preventative care covered at $0. So it just takes some time for you to plug in a couple of things to see what you qualify for. I think I got all of my questions over here. I'm pulling my questions from the loop. Alright. Interested. So everybody, I can't message everybody. Okay, so what I'm going to do is I'm going to put a quick link in the YouTube description here. That's going to let you know how to click and plug your information in. But you can also reach out to me if you want a link to my live Zoom office. That works too. You need additional help. So give me one moment here. Oh, okay. Mm-mm-mm. Let me click it. There we go. Okay. There we go. Okay, so I'm putting it in the Zoom. I mean, not in the Zoom, in the YouTube link now. If it will allow me to be on YouTube. As far as qualifying events go, if you currently have coverage and you're needing to switch for whatever reason, it's not serving you, you can always pick this plan up, and that will be a qualifying event for you to cancel the current plan you're in. Qualifying events are you've recently moved, you've recently had a baby, you've recently adopted a child, um, you lost your current coverage. There are several things that fall under that. I'm going to just see if I could do this. Okay. Okay, understand it. Alright, so this link, I'm gonna leave it up for a while, but I'll pop back on in a minute because I have a couple messages I have to respond to and possibly help a couple of people to complete their applications. So I will be back shortly. Feel free to reach out to me, give me a call, shoot me a text. Again, my number is 561-412-5218, or you can DM me on social media. But I will definitely be getting to you as soon as I can. It's just very busy with OEP ending tomorrow. So talk to you all soon.